If I conferred with our furry friends, man to animal, think of the amazing repartee. If I could walk with the animals, talk with the animals, grunt and squeak and squawk with the animals, and they could talk to me.
Hello and welcome to Pet Watch, a monthly program about the Williamson County Animal Center. I'm Debbie Sims and I'll be your host today, and my special guest is Dr. Ginny Greene. Hi, Ginny.
Hi.
Ginny is the new veterinarian at the shelter, and we welcome her with open arms. And how's your first month been?
Well, it's been wild.
Been wild.
Having a good time, yes.
Yeah.
So.
We are inundated with cats and kittens. It's kitten season, and
Yes, it
so
is.
Dr. Greene has sort of had a trial by fire with all the kittens coming in the door. But I wanted our community to have a chance to get to know you. You went to Kansas State.
Yes, ma'am.
Are
Go
you
Wildcats.
Are you a Midwestern girl? Or?
I am. I grew up in southeast Missouri, a little town called Charleston, Missouri, and lived there most of my life. And then we traveled around some as I was a teenager with my mom and dad, and ended up in Kansas. So ended up at Kansas State University for veterinary school.
Great. Yeah. What was your area of concentration in vet school?
Well, when I was in vet school, which was a while ago, as a 2002 graduate, we really focused on everything: food animal, small animal, large animal. So I got a very broad, amazing, education through Kansas State. And as far as any special concentration for me, my undergraduate degree was in microbiology, so I enjoyed looking at things underneath the microscope, cytology, cells, that kind of thing, which I get to do a bit of that at the shelter. So
that comes in handy.
It does. It does.
Because you can do a quick blood smear and look and see many things.
So I enjoy that.
Yeah. Did they have a farm on the Kansas State Veterinary
They
campus?
did. Lots of farms.
Really?
We had a buffalo that we got to go and vaccinate. So that was an interesting experience, and they have a great dairy there, homemade ice cream. So
Oh, I didn't know that.
Yes.
I know a lot of vet schools, most vet schools have farm programs, where you get exposed to a variety.
I did, and I actually loved that aspect of veterinary medicine. It's fun, but backbreaking and mentally taxing. So small animal fit my lifestyle a little bit better, but
You have to be
love food animal.
pretty strong to deal with cows.
You do.
You have to be a Dr. Pole type personality as well.
Gotta be. I didn't quite have the strength for that, but I enjoy it. So.
Yeah. Did you, was surgery something that you were particularly interested in?
I liked surgery. The older I've gotten, I enjoy internal medicine and emergency medicine, a little bit more, but I still enjoy surgery, and we do plenty of that. So.
Yeah, and you came to us from an emergency clinic in the Nashville area.
I did.
So everybody knows how a private practice works, because we've all taken our cats and dogs there for checkups and so forth and routine things. And so how does pet emergency medicine vary?
Well, honestly, I approached it very similarly, really. I mean, I guess the big difference is we don't always have a chance to bond with our patients and our owners the same way general practice gets to. When you get to know somebody and you've brought your pet there since they were little. So this is a little different. It's scary, for folks. So I think, a little gentle touch is always helpful, with emergency medicine. And then, of course, often dealing with much more life-threatening situations on a daily, basis was a difference, of course, in trying to help people make decisions on the spur of the moment, So that was, a challenge, but, really rewarding. Aspect of veterinary medicine.
It's kind of like a person going to the emergency room.
It is.
It's with chest pain or something, and you're scared.
You're scared.
Or you're taking your child to an emergency room, and you're scared for them, and you just, emergency medicine is part psychologist, I'm sure, but you got to get that animal back to a diagnosis in a triage situation and see what's wrong. Because many times you don't know. I mean, if they've been hit by a car, you kind of got an idea, but if they're just ill, you've got so many things to go through your mind, right?
Exactly, trying to figure it out as quickly as possible. And veterinary medicine is tough that way. Sometimes it's hard to get a diagnosis, and sometimes the tests don't tell you everything you need to know. Although I don't think human medicine is that different when it comes to that either. And hey, we can talk. These guys can't, so sometimes that makes it a lot more difficult.
Yeah, I think veterinary emergency medicine is probably better than human emergency rooms sometimes.
I know, we have a lot of hardworking doctors and technicians, that's for sure, that do amazing jobs. So,
what does the modern emergency clinic have as far as tools for diagnosis? I mean, people would be surprised what
Well,
there
you know,
is.
there's several emergency clinics in town, and I mean, we have facilities in Nashville that have everything: CT, MRI, ultrasound, in-house, you know, blood work, of course, X-rays, you know, and any sort of medication they need. I mean, these guys are getting, you know, catheters in their jugular veins, you know, all kinds of advanced procedures that, you know, most of the general practices aren't doing, although some, you know, are well equipped to do that in this area.
Some have an X-ray or
Most of our
ultrasound.
our local clinics have, you know, that, but probably the basic tests when something comes in sick on emergency is, of course, lab work, X-rays, and then sometimes ultrasound, you know, is the next step. And some things are really easy to figure out, and some things are, like I said, much more, you know, difficult and require advanced testing, which is when you get into your, you know, your MRIs and things like that. When that stuff's needed.
And years ago, veterinarians, you didn't have anybody to rely on once your veterinary office closed for the day. You either had to know them real well and call them up and say, can you meet me at the clinic? My dog's eaten something, or they're poisoned, or they've been hit by a car. But the world is changing, and now we have 24/7 emergency care.
Absolutely. Absolutely. Well, people want that. We love our pets.
They do.
So
They do. And we'll go to many means to take care of them.
absolutely.
And I've seen some of the emergency clinics even have subspecialties inside, like
Yep, two of the facilities in town during the day, you know, they have internal medicine specialists, dermatologists, oncologists, you know.
cancer treatment, oncology,
Yep. So,
and dermatology. Wow.
dermatology, bone, you know, surgeons that specialize in soft tissue versus orthopedics, so broken bones and ligament injuries, things like that. So we've got it all.
The veterinary medicine has sort of become a field that does have specialties now. It may not have been when you were in school,
Definitely.
but it's changing a little.
Yes,
My
it
friend's
is
son
changing.
is doing a surgery rotation after vet school, and he's at UC Davis for 2 or 3 years.
Yep. One of my best friends is a cardiologist, veterinary cardiologist.
Cardiology, wow.
Yes. So, I mean, just amazing things and just amazing things that we can do now, which, you know, is great to prolong quality of life, which is important, you know, with our pets. And, you know, sometimes being able to cure some things we couldn't do, you know, 20 years ago. So,
Sometimes there was no treatment.
nope, there was nothing you could do. And now we have a lot more options, you know, which is great.
And there are a lot of diabetic animals too, aren't there?
I have one in the clinic right now.
Yeah. Oh, really? Okay.
We
So
do.
that's something that comes through the door at the shelter.
We do. You know, unfortunately, we have pets sometimes surrendered with certain medical issues that we try to manage, you know, if we can. And this kitty cat's one of them. So hopefully we'll get him squared away and find him a home. So.
Well, so many things in animal medicine a few things are preventable, like heartworm medication. Is that important for dogs, but is it also important for cats?
It is important for cats, particularly if they're outside. Cats get heartworms, and the difference between dogs and cats is it doesn't take but one heartworm, which basically lives in the pulmonary vessels, you know, inside the chest. It doesn't take but one for them to be clinical, and we don't have an effective way to actually treat them. We do have a medication we can treat dogs with, although it's not without side effects, you know, so it's not a benign form, you know, of therapy. So it is important that cats, especially our outside cats, you know, get some sort of heartworm prevention. A lot of the topicals are heartworm.
And that's carried by, how does the heartworm get to the animal?
It's injected basically by mosquitoes when mosquitoes take a
bite
blood
the
meal.
animal? Okay.
Passed
So
by mosquitoes.
flea and tick or mosquito prevention is now coming into play.
It is, and it's going to help. You know, it's not going to necessarily, if you're like me, and I've been covered up with bug bites this year, it's not, you know, they're going to bite you, but we do have some newer medications that help control the mosquito population, you know, as well. But, you know, keeping your yard mode, keeping stagnant water out of your yard, those kind of things help with fleas and ticks. And ticks are also, you know, a big problem this time of year, and we're seeing lots and lots of them.
I for years, I gave my dogs heartworm preventative, thinking that would prevent them from ever getting heartworms. And now it's my understanding that a mosquito could still bite your animal, and the pill actually goes after the early stages. It's
Can keep them from ever developing.
keep him from developing.
Yes,
So that's why if
into
you
adult
forget it
heartworms.
for a couple of months, your animal could get
Could get it.
heartworms.
Yes.
And if they get it, it's a long treatment with a very powerful drug with the confinement stage for their exercise.
Yes.
So it is costly to treat.
Yes.
And it may seem expensive to pay $10 a pill or
Yep, but
whatever you have to pay.
Definitely not in
it's
the long
definitely not in the long
Yes,
run.
It's just best to keep them on it. Test them yearly, keep them on prevention, yearly, and certainly do your flea and tick prevention, and that's going to go a long way to help keep your pets healthy.
Should you have them tested even if you've been doing the preventative?
Absolutely, because most of the heartworm manufacturers, if you have a pet that's been on that product consistently and been tested yearly, a lot of those guys will pay for the cost of treatment if your pet gets heartworms.
Oh.
So it is important to follow your vet's guidelines, when it comes to that.
Yeah, and so ask your veterinarian what the dosage and the best place to get the preventative.
Right.
If you need to know your animal's weight when you buy them preventative drugs.
Correct.
Okay, or you flea and tick or heartworm, you just need to know your animal's weight. That's how most of those dosages?
Yes, those are usually based on weight.
Okay. Now, when we go from your emergency vet life, you're now a shelter vet. And shelter medicine is quite different than emergency
Yes.
medicine, and sometimes you do see some emergency cases. But for the
definitely.
most part, when an animal comes in, what's your first evaluation? What kind of testing do you do?
Well, as far as the shelter, we're concerned with our entire population. And one of the biggest things is infectious disease. So disease that's going to spread from one individual to the rest of our population. And unfortunately, there's a lot of those types of diseases out there. So when something comes in, the first things we're looking for is, do they have diarrhea, loose stool? Do they have skin lesions that could indicate ringworm, which people can get. So we really have to be careful about, ringworm. Do they have runny eyes or nasal discharge? Because there's a lot of upper respiratory diseases that are really contagious. So those are probably, that's the biggest thing that I'm looking for, just looking, at a pet that comes in. And obviously treating those things, trying to isolate those pets, as well to try to protect the rest of our, population. So.
And what else do we have to do to each animal that comes in? Do we have to immunize?
We do. All the animals that come in are going to be fully vaccinated, with either, rabies, of course, and then for dogs, they get bordetella or kennel cough, and they get their distemper parvo vaccine, and kitty cats get their upper respiratory virus vaccine as well as rabies. They get dewormed, they get flea and tick prevention applied, and heartworm prevention if they test negative. We do test the dogs.
So you test them for heartworm?
Test the dogs for heartworms. We test the cats for feline leukemia and feline AIDS, and try to make sure we've eliminated some of the big things, that could prevent them from being adoptable, or if they have special needs, that we need to address.
Right.
So.
It's just an ongoing everyday cycle of animals being surrendered with no history, or animals that are found have no history. So we're really starting from scratch with every patient is a new patient.
We are.
Yeah. And the lab diagnosis part is so important to screen out in the
Definitely.
beginning. You don't want to put a cat into the cat population that has a communicable disease of some
Correct.
kind. And let's talk about upper respiratory. And let's talk about cats for a minute, because summer is kitten season. It's notorious. This year it seems worse than ever.
It is bad.
We're taping this the end of June, and near the end of June. We still have 5 more days left, I think, 3 more. And we have taken in 315 cats as of yesterday, from June 1 through 25th. A phenomenal number. Now, some of those went to foster. A very few cats get returned to owner. That's not as common as with dogs.
Nope.
But the cat population problem is totally preventable. What do you tell people? I like to tell people, if you're feeding an animal, you need to spay and neuter that animal.
Absolutely. Absolutely. If you don't want to take responsibility for them, don't feed them. Cats are very capable of taking care, of themselves. But if you start feeding them, hey, it's an easy meal, and none of us wants to think about a pet starving, but cats are resourceful. So,
Yeah.
And yes, we need more people involved with, trying to humanely trap some of these cats and get them to us so they can be spayed, or neutered. And if they're wild, we can release them and let them go ahead and live their cat lives, but they're not reproducing and contributing to the problem. Because all of these cats that we've taken in, I would say 85% of those cats probably kittens, and most of them were sick coming into our facility with upper respiratory disease.
Right.
So
Right.
runny eyes, snotty noses, eye ulcers, tongue ulcers. So sick and debilitated kittens, and we've had some wonderful fosters, take these kittens, into their home and help us treat them, because we
Right.
couldn't treat them all without those folks. There's not enough hours in the day.
And we actually
to do it.
converted a space that's got to be 40 by 20 square feet into, we took a storage room and had to make it a cat room, but it's close quarters. And so
It
if
is.
any of the kittens have upper respiratory, it will spread despite our best efforts.
Yes, in our current facility, it's really hard to isolate, so it does, spread. And that's a big problem. Also, the overcrowding contributes to stress, which also contributes to those upper respiratory signs. So we just have a multifactorial, problem in our facility right now, which we're working really hard to try and improve it. And, coming in and adopting adult cats is also really, really helpful. Adult cats, they make wonderful pets. You miss all that crazy kitten stuff, all the
Right.
scratching, all the biting, all the
Right.
stuff that kittens like to do,
Right.
and you have this nice, happy adult cat that could be with you, and likely will be with you for years. And we have so many nice adult cats that need homes. So would definitely encourage folks to think about taking a cat in.
Yeah, I had someone tell me yesterday that their neighbor has an unaltered female, and that she leaves her garage door open and leaves food out, and the cat has litters every
Probably 3 to 4 months. Yeah.
Every 3 to 4 months, a cat can have them. And how young can a kitten become impregnated?
Probably 9 to 12 months.
Okay.
We've seen some that were, by a year of age, they're
By a
certainly
year, they could
sexually
have their
mature.
first litter and then have one every 3 to 4 months.
Yes.
And aren't the numbers astronomical, what 2 unaltered cats can make?
Well, yes, because if you've seen the little charts they have,
Yeah.
they'll just show you, 2 cats, and then, within a certain amount of time, you've got 100 cats, and it's not long.
And in 7 years, you have in the hundred thousands.
Exactly.
So it's
Yeah.
amazing. So if you think, well, my cat's not causing that much trouble, but if it's outside and you're feeding them, you are responsible. And I just encourage everybody to do that, to stop doing that and get them spayed or neutered. And we'll be glad to help. If people want to call the
Absolutely.
shelter, we will talk to them about how to trap the cat humanely and resources for getting
Yes,
that cat.
do what we can, to help you out. And the other problem, we're having, because we do have a trap and release program, is that if you can't get all the cats at the same time, you've not really helped the problem, because of the issue that you just said, with all it takes is, a female and a male that are sexually intact, and the problem just starts all over again. So, and that's tough, cats are smart. And,
Yeah, and you're
so
not
trapping them can be tough, but you need to get, all of them.
Right, and in your home situation, if you have an outdoor cat, it's not spayed or neutered. Where are the kittens? I mean, they're having these kittens, they're leaving them outside, and then they're being killed by wildlife. They get diseases.
Yes.
They don't thrive because nobody's taking care of them. So you're really not being a very responsible pet owner. And we do have resources we can refer you to for low-cost spay-neuter if finances are an issue.
Absolutely.
There are plenty of groups
Yes, there's
around.
lots of groups willing to help, in the Nashville area.
Yeah. Well, let's talk about spay-neuter a little bit. I know you can't catch up now because you've been thrust into a situation, but ideally, wouldn't we like to get everybody spayed-neutered before they went into adoption? Yeah.
Absolutely. We like to do that so that they can just leave and not have to return, with the new owners. So we try very hard, to do that. But it's hard to keep up because there's so many. Right now, we're probably doing anywhere, depending on how much help we have, with surgery, anywhere from 50 to 100, a week, at least. And most of those being kittens, at this point. So
Yeah. Well, that's a lot of spay-neuters, and
Yes.
it's basically every animal we adopt, we spay-neuter. So, we had 4,000 animals pass through the facility last year. And
I'd say it might be more this year.
Might be more. Last June was also tough. I looked at the numbers. But when you think about the kittens that have come in, and like you said, many of them went to foster homes because they don't have a mother cat with them, and they need to be bottle fed. We have them come in with the umbilical cord still attached.
Yep.
and no mother. So somebody has to bottle feed or tube feed these kittens for months. Now, how big does the kittens have to be before they could come back to the shelter?
Right now, I think we're having our fosters bring them back around 12 weeks. So basically at the point that we can spay and neuter them and they're old enough for rabies vaccine. Once again, trying to help folks that are adopted not have to come back multiple times, for things these guys need.
Because if it happens that they haven't been spayed or neutered, people leave a deposit and they make a refundable deposit and they make an appointment to come back.
Yes, because we definitely, that's always the problem with sending, cats out and dogs out, not spayed or neutered. We always worry. Life gets busy and we just worry, folks will forget to come back. And it is super important because, yes, you're spaying and neutering for, population control, especially in a shelter, situation, but there's health reasons, to spay and neuter your pets as well. So, there's multiple reasons.
What is that like? Do you think people still have an idea that spaying and neutering their, especially dogs, is going to, how does it positively affect the dog?
Well, as far as our males, it often eliminates marking behavior, in the house, which some male dogs will do. It tends to make them less likely to roam if they get outside on you. For females, also, spaying and neutering helps them from getting mammary cancer, which is pretty aggressive cancer, later in life. Females also get uterine infection called pyometra that can require emergency surgery, later in life, and it's caused by hormonal, influences.
So mammary cancer is like breast cancer in humans?
Like breast cancer in humans.
Okay. And that's in cats and dogs?
In cats and dogs,
Wow.
although more common in dogs, I would say. The other thing, if your pet develops a seizure condition or diabetes and they're not spayed or neutered, spay or neutering often helps manage those diseases or makes it easier to manage those diseases. So there's some reasons, to do it.
I can't think of any negatives. Can you?
No, there's not a lot of, negatives as far as, spaying or neutering.
Right.
And it typically tends to help and usually is without complication,
Right.
as far as surgery.
It's a simple surgery.
Goes.
It's done in a
usually
few.
goes well. And the younger they are, usually the easier, it is on them. So that's nice as well.
And they usually are there they drop, if we have spaces in our spay neuter program, or your veterinarian is going to do it, or a group like Pet Community Center has a spay neuter. They have free ones.
Yes.
If you just follow them on Facebook or look them up on the internet, you just drop your animal off and usually pick them up that afternoon, and then you're just restricted from getting them wet and sort of monitoring.
Monitoring their
Do they have to wear a
incisions.
cone?
A lot of times we'll bury the suture so there's no visible suture, which helps. But if they start to lick, we always recommend you take
That's
the cone of shame.
The cone of shame is to prevent
Prevent them from chewing
or licking the stitches out.
Exactly.
Yeah. Well, one more question for you before we wind things up. What's your advice to a person who's a prospective adopter that comes in the shelter? What should they expect as a pet owner or dog owner? What's your best advice to someone who's choosing a pet?
Well, I'd say I always say pick pets that are more interested in you than the other animals, in the facility,
Okay.
Take your time and realize there's always a transition whenever you bring a new pet into your home, and sometimes, every time I always tell people, every time I bring a new pet into my home, I'm like, what did I do?
Yeah.
But usually within 2 or 3 weeks,
I followed my heart, and
things
now
settle
I have
down.
to deal with the reality.
Exactly.
Yeah.
Things usually, settle down and establish a relationship with a veterinarian, when you leave the facility, preferably within a week, let your vet take a check over, meet your new addition, and those kinds of things.
And go
are
every
really
year.
important. Absolutely, go every year. Dogs and cats, as they get older, routine blood work is helpful to screen for, underlying disease. And, there's nothing that replaces a physical exam. Having a veterinarian listen to your pet's heart, checking lumps and bumps that may pop up as they get older, all those things
Right.
are going to help, with
And
the
cancer
longevity.
is becoming more of a prominent
It
issue
is. I mean, they get
with
cancer.
pets.
They do. They live long enough. A lot of them, end up with it, and a lot of it can be fixed with surgery, but the sooner the better, with
Right.
with anything. So your veterinarian's going to have the capability for some early detection testing,
Right.
just like we
Right.
recommend with
It's
people.
just like cancer in humans. The earlier you catch it, the more curable it is.
The more that can be done.
And early diagnosis is so important because losing a pet is such a crisis emotionally for everyone. And just an annual exam, even if your pet appears healthy, many veterinarians have told me they found cancers just by coming, oh, my pet's
Yes.
healthy, I've gotten the rabies shot, that's all I need. That's not the case, and you should treat it like a family member, like a child who's on a schedule to go once a year to see how they're doing.
Absolutely, they're a commitment.
Yeah,
and,
they are a
and
commitment.
You're obligated to provide, appropriate care.
Yeah. Well, I appreciate you being with us today.
Thank
and
you.
letting us know about your hard work you've been doing at the shelter, and it will continue. And we're just glad to have you.
Oh, glad to be here.
I want to mention to our viewers that right now we have no fee on all adult cats. We have $10 adoption fees on kittens, and you get a companion kitten if you want it, a second one at no charge.
Two's better than one.
Two's better than one, Doc says. Now, we have a monthly rabies and microchip clinic at the shelter July 28th, and the rabies shots are $10 and the chips are $15, and that's for cats and dogs. You are required in the state of Tennessee to have that rabies shot. We will be closed on Wednesday, July 4th. If you'd like to become a foster or volunteer, go to our website, adoptwcac.org, or come by and see us at the Williamson County Animal Center, 106 Claude Yates Drive in Franklin. We're open for adoptions Monday through Friday from 10 to 6, Saturdays from 11 to 3, and Sundays from 12 to 4. You can follow us on Facebook. That's a great place to find out all the new pets. We post them daily and let you know what's come into the shelter. And if you go to our website, we use the Pet Finder link there. You can look through the animals. So come by and select the animal that's best for you, or like Dr. Greene said, the one that comes to you and pays more attention to you than the other animals around it, maybe the pet you're looking for. I thank you for watching, and I hope you'll join us again next month on Pet Watch.
If I conferred with our furry friends, man to animal, think of the amazing repartee. If I could walk with the animals, talk with the animals, grunt and squeak and squawk with the animals, and they could talk to me.
Stimulus by S.R. Lee. Wherefore? Moonlight, coffee, wind, chocolate, dawn, tea, rainbows, sugar, at fingertips or by rare chance, cold water, fragrance of baking, sunlight patterning through leaves. But then, why? Lethargic body, mind, heart waking, drugged with weariness or its opposite, oversleeping. Meanwhile, the daydreaming mind envisions plans, ambitious, lovely. The body stretches and squirms, feels the smooth sheets, the cool room, rises, staggers, an uneasy balance, then off to morning chores of scrambled eggs, buttered toast, and the imagination begins to recoil with horror at the stimulus notions of a 2-mile run in the morning fog, or morning of baking a 3-layer cake, or finish the landscape painting, the child's Sunday dress, the attempt at a sonata. The whole person shrinks back, settles for the op-ed page of the New York Times, though the stubborn mind holds an image of moonlight bright in the forest.